Everyone. Why can't I conceive? So, this is a question which is asked frequently by couples who are trying to achieve a pregnancy. I am Dr. Vani Sundarapandian, Medical Director of Chennai Infertility Center, and my talk today is aimed to dispel certain myths regarding this topic and also to provide guidance based on scientific evidence. So, coming back to the topic, the first question is, have you given yourself sufficient time? In a minority of couples, pregnancy occurs very quickly in the first month of trying. And in movies, of course, pregnancies occur very quickly. So people generally believe that there will be a pregnancy in the first month or two of trying. But this is not usually so. Humans, in fact, are the least fertile of all species, and they take time to conceive. So evidence has shown us that about 80% of couples, provided the woman is less than 35 years of age and no contraception has been used, they do conceive at the end of 1 year. And another 10% of couples do manage a pregnancy at the end of 2 years. So 90% of couples, provided they're young, do conceive within 2 years of trying. Therefore, if you haven't given yourself sufficient time, it's important to wait and keep trying. The second question is, have you been trying properly? Now, to understand this, you need to understand a bit about the way the egg and sperm function. Now, in a 28-day cycle, the egg is released round about day 13 or 14, that is in the middle of the cycle. The egg is capable of being fertilized for just 24 hours. But the sperm is hardy and is capable of fertilizing the egg for at least 48 to 72 hours after its release. Therefore, it makes sense to start trying and to start having intercourse about 2 to 3 days from the end of a period right up until 1 week before the next anticipated period. So theoretically, there are always sperm present whenever the egg is released to dress and fertilize the egg. Now, if you're using an ovulation detection kit, then when you have a positive ovulation sign or test, it means that the hormone LH has begun to rise. And that means ovulation will occur about a couple of days later. So you need to start having intercourse for the next 2 to 3 days once you have positive ovulation test. So the next question is, are you fit and healthy for a pregnancy? Obviously, I'm going to talk about lifestyle, and these changes are well within one's capacity to take care of. The first thing, the usual thing, is weight. Is your weight ideal? Because we know that when women have a high BMI of above 30, they take a longer time to get pregnant. And men who have a higher BMI higher than 30, have reduced fertility. So it's important for these couples to lose weight, and if you're planning on losing weight, of course it's exercise, increase your protein and fiber intake, reduce your carbs, and cut sweets altogether. And what happens if a woman has low BMI, a BMI of less than 19? If she has irregular periods, it means she isn't ovulating and she needs to increase her weight, and that will help. The next lifestyle change is regarding smoking. So both active and passive smoking are an absolute no-no, and the only solution is to stop smoking altogether. Regarding alcohol, 1 to 2 units of alcohol per week or once or twice a week is okay for females, and for males 3 units per day and not more than that. This is the recommendation. But intoxication, once again, is to be avoided. The next question you need to ask yourself is, are you getting enough sleep? Sleep is very important, and sleep at night is very important. You need to have at least a minimum of 7 hours sleep. And if you're not sleeping enough, it can cause hormone dysregulation and affect your reproductive health. Caffeine, there's good news about caffeine. There is no clear association between the intake of coffee and reproduction, so caffeine in moderation is definitely okay. Now, The usual advice which is given to IT personnel is not to place your laptop on your lap because of heat generation, which can affect sperm production, as well as to avoid wearing synthetic, tight undergarments. If you have any thyroid problems or hypertension or diabetes, these need to be dealt with, they need to be checked, and they need to be under good control. And all women who are trying for a pregnancy need to take folic acid. Now, folic acid is a B group vitamin. It doesn't increase your chance of getting pregnant, but it helps the baby's brain to grow normally and reduces the incidence or the risk of a particular defect in the brain, in the baby's brain, called a neural tube defect. And this needs to be started 1 month before planning a pregnancy and needs to be continued for at least 3 months after you're pregnant. Right. Now, there is an important take-home message, especially for women. We must understand that eggs don't last forever. A baby girl is born with about 1 to 2 million eggs in her ovaries. And by puberty, that number reduces to 300 to 500,000. This decline is very significant after 32 years and decreases very steeply after 35 years. And by 40 years, the woman has very little eggs and therefore can have a problem conceiving, naturally as well as with treatment. Now, it is not only egg numbers which reduce after 35 years, but it is also egg quality. So there will be an increased risk of miscarriage and having children with birth defects like Down syndrome, the later or the older a woman is. Now, does age actually affect men? We've heard so many men father children at 60 years, and we've always believed in the past that age never mattered as far as men were concerned. But now we know that men above 40 years, they can take a longer time to impregnate their wives, and it can result in miscarriages, or there's an increased risk of miscarriages with aging men, as well as a small increase in birth defects. Okay, so when should you seek help? If you're less than 35 years and if you have been trying properly for 1 year, then you need to visit a fertility specialist. You need to check things out and make sure everything is normal. And if everything is normal, most likely you'll be advised to continue trying for the next 6 months to 1 year. If you are 35 years or greater, it's best to try for just 6 months naturally. And if you haven't conceived, it's very important to meet a fertility specialist. Now, if you're 40 years, it's very important to meet a fertility specialist right away, because you need to check and make sure everything is fine, and you need to be assessing your fertility at that time. So age is the most important determinant. So in summary, if you're having problems conceiving, 1, consider whether you've given yourself sufficient time. Make sure you're trying properly. Make sure you're fit and healthy for a pregnancy. And remember, be mindful of age and seek help early. Thank you very much.